Hello and welcome. This is Talk to SSBC, where we discuss cross-cutting issues. Today I'm glad to be joined by the National Minister of Health, Honorable Yolanda Awel-Deng, who is going to talk to us regarding the Ebola virus that was declared in Uganda and how that means in South Sudan. Welcome to Talk to SSBC, Honorable.
Thank you, Duku. I appreciate you.
Yeah, Honorable, on the 20th of September, the authorities in Uganda declared the Ebola outbreak. What is happening in South Sudan? Are we safe?
At this moment, my brother, safety is relative. Definitely we are safe in South Sudan because we have not confirmed any case yet as we speak. And also we have got a team that is already at our borders doing thorough work, screening and everything else. And also we have got risk communication team that is already out there in the community, especially at the borders, to inform our citizen, about Ebola and all this kind of thing. So at the moment we are safe and we know that we'll continue to be safe.
I understand the virus is increasing in Uganda. The cases are going very high. And given the situation that our borders are always open, how do you manage to control such movement?
South Sudan has got porous borders. Very few borders are highly controlled. That is, for example, Numili, like Numili Road border, like the Numili crossing point, the main one, is highly controlled. We have got team on the ground that does a thorough screening. And then we have got a response team just in case if we suspect somebody has got symptoms. We take them to the isolation unit. And for viewers who actually saw me on Sunday last week, I had gone there and we inspected like both the screening area, we inspected the isolation area, and also we review like the measures that we have in place. So at the moment, our major crossing borders, we have got measures in place, including our international airport, Juba International Airport. We are also doing the same screening. And if something was to happen, we have got the facilities, and our doctors are actually like ready on site at the same time here in the headquarters to respond.
Okay, you have set up already a facility at Nimuli border.
We have a facility.
What about in Kaya?
In Kaya, we had got the, what happened, we reactivated like the previous existing structures. If most of you are aware, in 2018 to 2020 period, when there was an outbreak of Ebola in DRC Congo, South Sudan was actually already prepared, by that time. So those facilities are existing, but they need to be renovated because, as we know, South Sudan is hot and we have got tear and wear. So some of them are actually having a facelift, like at the moment, and we are managing with what we have.
How do you cooperate with the Ministry of Interior, because they are in charge of the borders? How do you cooperate in terms of handling that movement of people in and out?
As you know very well, there's no ministry that could spearhead an outbreak by themselves. For example, in Uganda, they have declared it as a national security threat. Like their police is actually on board. Their army is actually on board. All the arms of government are actually on board. Right now in South Sudan, Minister of Interior, especially IGP, last week when I went for that visit in Numule, I was given a unit that I went with. And this unit are the leadership of the border crossing in South Sudan and livestock. They are the one who enforce laws at the border. We are a technical ministry. We treat patients. We treat citizens when there's a disease, but we do not enforce law. So at the moment, we are working hand in hand to make sure that these borders are not crossed illegally without screening.
There are reports on the internet that your team at Nimule, they got one case of the virus. How true is that?
I will dispute that. It's not one case of virus. It's a suspected case.
Suspected case.
It will be a one case of a virus when our tests confirm it. Yes, we have got a 45-year-old male that came in from Uganda, and that individual was screened, and that actually proved to you that our screening measures are actually working very well. He was screened. When we found that he has the symptoms, He was taken to the isolation facility. He's actually now in a stable condition. And we are also doing like the contact tracing to make sure that anybody that came in contact with him and they have symptoms is also to be isolated.
Briefly, just explain what is Ebola virus? What are the symptoms of Ebola virus?
Symptoms of Ebola virus are not actually very strange from the common symptom that we know. One of the main symptom is the sudden onset, like a fever of 38 and up, like vomiting and diarrhea, blood coming from the opening of the body, and then recent history of travel, in this case to Uganda and maybe Congo.
Okay.
Yeah.
So just in case, like, if you happen to get a case of Ebola virus, what would be your first step? What action would you take?
Right now, as I told you that we have got a suspect. So let's say we screen, travelers coming in from Uganda or from anywhere by the way around the world, because we need to realize that this particular strain of virus we are dealing with, it is a very sneaky one. We call it Sudan strain. And Sudan strain can slip through testing very easily. It can slip through, screening. It takes between 2 to 21 days of incubation period. So you can leave Uganda, come to South Sudan with no symptoms, proceed all the way to America, and then come back, and then you actually develop symptoms. So when those symptoms actually occur, and we suspect that you have got Ebola, it's a suspect at this time, we will collect the samples. Like we will send the sample either here to Juba or to the neighboring countries, like to be actually tested and analyzed, and at the same time we will under watch. And then from there, when we are in the holding unit, we have got the holding unit, let's say at the Juba airport. We have got a holding unit. When we suspect it, we put you there. You are transported by ambulance, to isolation unit. And then from there, sample are already taken, you are tested, and you are taken care of.
Okay.
And also we have got what we call 72 hours, like procedure for all these things to kind of happen.
How is the situation generally in Uganda now?
The situation in Uganda is very fluid. At the moment, we have got 54 confirmed cases, or 54 is increasing, and then and also like the deaths are also 35 deaths as we speak, and we need to know that each time we have got one person that is confirmed case, we have got several people that are in the community that we know. Because, for example, now I'm talking with you. We have got a close contact. I have not shaken your hand. I've greeted you, but let's say if I shake your hand, if I was sweating, and if I have the disease, I pass it on. I'll be infected and I'll be taken care of by somebody else in the community. So the case in Uganda, the situation in Uganda is very fluid, and the cases are actually still increasing. And 90% of the people that report themselves to the health facility are taken care of. But we still have got more in the community. And that's why it is important for our population in South Sudan to be vigilant. That's why it is important for our population in South Sudan not to be scared. When you feel these symptoms are there, and this symptom, my team, technical team here, I've actually sent them out already. We will make it very, very, very widely available, just like the way we had got the symptoms of coronavirus widely circulated, the measures widely circulated, so that when you find somebody like that or you see somebody like that, the best thing to do for our country, for the security for the nation, is actually to send this person to the healthcare facility. We have got trained healthcare personnel that will actually take care of this person.
Okay.
Yeah.
What could be some of the guidelines that maybe your ministry have developed to the public, so that somebody can follow those guidelines not to get the virus?
If we follow faithfully the guidelines of coronavirus, the hand washing, the no contact, like shaking hands, keeping a little bit of distance, and all this kind of thing, we will be safe, because coronavirus, Ebola, is gotten through fluids of the body, like the blood, the saliva, the urine, the feces, and also like the what we call sweat. And also we should not also forget the bodily fluids, like the intimate body fluids. You could also get Ebola through those. If we make sure that we wash our hands, we keep away from this suspected case of a person or somebody who's not feeling well, and also you protect yourself, even if they're your loved one, even if like they are your wife or your child, or you try also to protect yourself to protect them, and also avoid bushmeat at this moment.
So you mean the guidelines are the same like those of coronavirus?
How
different is coronavirus from Ebola?
There are two different strains of viruses. Like they are not really the same. Ebola has got its own different strain of and the strength, and coronavirus, it is not fatality rate or mortality rate is very less. 90% of population could get it, and chances of surviving are very high. Like Ebola, it is very rapid, and chances of survival are very less if you don't get treated. But if you suspect somebody has, as I mentioned too many times, is having the virus, take them to the nearby health facilities, because it is treatable. It is something that is treatable. But when you bring somebody too late, the virus has already overpowered the immunity of the body.
We'll continue from there. Let's go for a short break.
Thank you.
Viewer, we are going for a short break. We'll be right back. Hello and welcome back from that break. We are still with the Honorable Minister Yolanda Awel-Deng, the National Minister of Health. Welcome back. Welcome back, Honorable. Yeah, so if you can just tell us briefly about the challenges that the ministry is facing in regards to the fight that you have launched for the Ebola virus. Do you have some challenges?
Thank you again, Duku, and thank you to the viewers, and thank you for tuning in. Ministry of Health has got a lot of challenges, just like any other ministry in South Sudan.
Yeah.
Our structures, like the healthcare structure, is not very strong, because we came out of the war of 21 years, and we inherited a very weak health system from Sudan. We are handling health sector with the little that we have. At the moment, my team at the border are facing quite a bit of challenges. For example, we are underfunded. Our funding is not enough. In the past, we used to have got ideology of people saying that Ministry of Health has got a lot of funding from international community. The funding in the international community is shrinking, because we are getting funding as everybody else, from the same pool. So
why is the funding shrinking?
The funding is shrinking because the global dynamic is changing. The global economy is weak at the moment, and also we have got some other crisis somewhere. For example, Ukraine-Russia war. Ukraine-Russia war is getting a lot of attention at the moment. And South Sudan has been on 8 since independence. For example, as I'm speaking with you, Ministry of Health do not even procure even a Panadol, to the citizen of South Sudan. We get everything from aid. We get everything from donation. The partners are actually pulling away from that. As I speak with you, I have got over 220 plus facilities that do not have any support. plus nine state hospitals, including our referral hospital, Juba Teaching Hospital, because like the UN agencies or the international partners and donors, their funding is reducing and they are focusing, like the energy somewhere else. So funding is like exactly like the main challenge that like we have in the Ministry of Health. And
the international community has been complaining of poor financial management system. Coupled to that, they talk of corruption. Don't you think these are some of the things why the international community is pulling out?
All these things you're actually saying are actually like relative. It depends from what angle you look at it. So, but the bottom line is, like I can tell you, my team is very good in doing accountability. But the bottom line is, most of the third world countries, their funding is actually shrinking, including the countries that are 100% clean. They just leave South Sudan alone. It has become like a cross-cutting
global issue.
It has become like the main thing, the global issue. So my team right now at the borders, we are trying to do the best that we can. Not forgetting that we have got most of the partners that are still with us. Like for example, World Health Organization. When I went for that field trip, they came with me. UNHCR came with me. UNICEF, they were on board. IOM, they are on board. But the help they are giving is actually very minute. And government is expected to put more like actually in the health sector, because South Sudan is actually a member state in the region and also internationally. And we also signed the commitment and the treaties. The commitment that we signed is what we call a Butcher Declaration. A Butcher Declaration is the 15% of the national budget should be given to health. At the moment, I'm so proud to say that the parliament and the government of South Sudan has actually like increased the health budget. But now we have to wait and see if this health budget is going to be executed. If this health budget is executed, our challenges are surrounding like the resources, because I need to accommodate the doctors. Like the doctors that are going to be responding 24 hours to Ebola, they need to sleep in hospital. I need to feed the doctors. I need to make sure that the incentive is actually like higher, because this is like a high risk, job. And at the same time, to make sure that like we have reagents for testing in the lab. At the moment, I don't have any. The little that I have, it is a little that we get from our partners. And also we are grateful to the cabinet. 2 Fridays ago, the cabinet approved very little money to actually respond. This is showing that like the government willpower. This showing that the government is actually leading, in this fight, and everybody else will now join in. Yeah.
In terms of personnel, do you have enough personnel to fight the Ebola virus, just in case it becomes a serious issue?
You'll be surprised that South Sudan has got enough trained doctors than the neighboring countries. We have got, due to the war, a lot of people went to overseas or the neighboring country to get education. We have got the best doctors in East Africa, but we are not paying them enough. And when you don't pay somebody enough, they are demoralized. Their motivation is actually very low and very down.
Correct.
So we have got the personnel, but as I mentioned, we need to actually give them incentive. We need to pay these doctors something equivalent to what a professional doctor may make in not even equivalent, but a quarter. Like right now, like what I pay a head surgeon, it is equivalent to what is paid to a cleaner, like let's say in a certain hospital in the neighboring countries. So we have got the personnel, we have got the human resource, we have got the capacity, we have got everything else at stake. But we need to step up to actually fund the health sector to be able to execute, and deliver health services to people of South Sudan.
So your major issue is funding?
It's funding.
Any other thing apart from that?
Funding goes hand in hand with everything else. Because when you have got enough resources, you'll be able to mobilize, like the community, what we call risk management. These remote communities, to tell them, this is how you do it. Somebody have got a certain death, for example. When somebody dies suddenly, you don't do like the rituals, like the body washing and the kissing and everything else, because you don't know, did they die of Ebola? Did they die of what kind of disease? But we send in what we call dignified, safe burial team. For me to send dignified, safe burial team to, let's say, 21 borders of South Sudan, I need money to fly them.
Yeah.
I need like logistic. I need, chlorine and all this kind of thing to disinfect the place and all this kind of thing. So 90% of challenges is centered around that.
About money.
About money.
Yes. What could be the solution, according to you? What could be the solution to solve this area of funding?
The solution right now, the government is actually quick to respond with the little resources that we have. And that's why I told you earlier on, the team is already on the ground. As I'm speaking with you here, where we are sitting, this is like emergency operational center. Like National Emergency Operational Center on South Sudan. It is Saturday and we are working. So the government is responding with the little that we have. But at the same time, I still appeal to the partners and the business community. The business community has got a role, like in health. In most countries, it is run by business community and government together, hand in hand, and then the partners will now join us. Yeah. So I think at the end of the day, we have got this triangular, model going on. We'll be okay.
That's very good.
Yeah.
Honorable, Ebola virus is a very deadly disease. I'm sure right now in South Sudan, there is a lot of anxiety that if it happens that maybe coronavirus is too much here, there will be a lot of worry. What is your message of hope to the people of South Sudan?
My message of hope to the people of South Sudan is this. Ebola virus, if it's going to be an outbreak, it will be like an outbreak like another one. We need to be vigilant. We need to follow like the measures that we have, and we need to work and make sure that like this is the war that we can win as a team. If somebody is sick at home with all the symptoms that I had mentioned earlier on, do not hide that person. If your loved one end up like in the isolation unit, and the healthcare team tell you that don't come here, leave this person with us, you need to trust us, because we are the technical expert like in this area, and we'll be okay. So there's nothing to worry about. Follow the hand washing, avoid contact with somebody that is suspected or somebody that suddenly fell ill. If somebody died suddenly with high fever, and we have got the blood coming out and in the opening of the body, just call the healthcare facility. We will send our dignified burial team and we'll handle it. So there's nothing to fear, there's nothing to panic. And as I always mention, if you panic, you will destroy more instead of being calm.
Okay.
Yeah.
Do you have something else that you want to say apart from what we have discussed?
One thing I wanted to tell our citizens is this. Health is security for our nation. Health is peace building for our nation. We need to focus on our health. Health is actually unity. If everybody contribute to making sure health measures in this country are actually followed, with the little that we have, even taking care of your own health. Let's say if you are sick of malaria, do not just go to any small pharmacy and just buy drugs and ingest them. You'll be doing more harm to your body. We need to take care of our health. And thank you.
Honorable Yolanda, thank you for talking to SSBC.
Thank you so much, Luku.
I hope to talk to you again some other time.
Appreciate you.
Yeah.
Thank you.
Viewer, we have come to the end of this episode. See you again next week. Bye-bye for now.